This month marks 1 year since the COVID pandemic took hold in North Texas, and so much was so unknown back then. And in today's Ones for Wellness, I reflect with one of the first epidemiologists we talked to at the start of all of this. We take a look back at where we were, where we are now, and what's possibly ahead. It was more than a year ago when we first sat down with Dr. Diana Cervantes with UNT Health Science Center to talk about an emerging new coronavirus.
The concern is really for people who may have traveled to Wuhan and then within 14 days past that travel, they develop signs and symptoms. I would be concerned for those people, or people who may have been in contact with somebody who had traveled and had symptoms and then they develop symptoms. But in general, I think because they are doing so much at the public health to prevent other people from getting sick, that the concern is very minimal.
I would have never thought that we would be in this position where we would be at home and that we would have the lockdown that we had.
It's been a year of change, worry, frustration, and heartache, but also, Dr. Cervantes says, a year of breakthroughs. How is it transferred and how contagious is it?
That's something that really we don't know at this point. So they feel originally it may have gone from animals to human, and now that seems that there are some human-to-human cases, but it may be limited to people who have had very close contact. So maybe healthcare providers, people in the family. The worry is that is it going to be sustained transmission from person to person? So that's really what they're trying to figure out right now.
We really learned a lot about the virus, how it's transmitted, who's at highest risk, how to protect people at their work sites, how to protect people in their own homes, and then of course so much that we learned in regards to treatments, things that we thought would work that didn't work, things that we weren't sure would work actually worked really well.
What in terms of the virus do we still have yet to learn?
So I think one of the major things we still are in the process of learning is the long-term impacts. And we have seen many studies that have come out in terms of the long-term impacts. But again, we're just a year into this, and the majority of people really got infected really going into 6 months into this. So we still don't know. There's still a big question mark in terms of what does this really mean for a large group of people, the long-term impacts of having this infection.
What do you think are some of the most important lessons that we can glean from this experience?
We came a long way in terms of vaccine development and approval, and really the processes that involve the vaccine, and going from, do you think that we could even put a vaccine together, to actually a year later having shots in people's arms. It's really been incredible to see that progress.
Dr. Cervantes says the virus has highlighted the need to find ways to address health disparities and help those at higher risk. But as our knowledge continues to evolve, she cautions there's still an element of the unknown.
We do know that the virus does change, because all viruses change. So we need to think and be open to the possibility that we may have to change course at some time, but that we do have the tools and the resources to get us to a better place.
Dr. Cervantes expects over the next few months we will unfortunately see those occasional spikes, but she says over time we'll likely see those get smaller and smaller. She doesn't expect the virus to ever just go away, but hopefully it will become more in line with something like the common cold or the flu.